So part 2 is the inflammatory response. And this is basically what you need to remember that involves chemicals and cells due to any kind of injury, whether it's a cut, infection. So it's signaled by the presence of foreign substance, which are pathogens, or just an injury like you cut your skin, and stimulates the release of chemical mediators. So you have to remember that when you get into pathophysiology, you'll have to remember the whole thing about it, and also about the complement cascade that occurs. Just need to know that this is what it does. It has a complement. And here it is, just a real basic inflammatory response that you need to know. It's pretty basic. Your bacteria enters, the tissue is damaged. You got mediators, you got chemostaxis, which makes things permeable and increases the number of white blood cells, and phagocytosis. They're gone. You have tissue repair. And then if the first line of defense doesn't work, then you've got others to help you. It's kind of like a backup system. So here's about adaptive immunity. This is what you heard a lot about with the COVID injections and stuff. And it's acquired at birth, and it reacts when the innate defenses don't work. It's slower than the innate. The big thing you have to remember, it has a memory, and it uses lymphocytes. And here are these two types of lymphocytes, B and T, especially T cells because of AIDS. And it has two types of antibody-mediated and cell-mediated. So adaptive immunity is that. Terms related to adaptive immunity is antigen, self-antigen, sort of, but not as much as antigen and antibody. Antigens are the bad guys, and antibodies are the warriors. They go fight the antigens. So all lymphocytes are called stem cells, and stem cells are just real immature. They're nothing. They're all wannabes. They want to be red blood cells. They want to be white blood cells. They want to be platelets. So I kind of call them wannabes. And they live in the red bone marrow, and to give rise to some pre-T cells and pre-B cells. But most of the lymphocytes come from your thymus. And lymphocytes are a type of white blood cells. And they are in the adaptive immunity, stem cells. And they will differentiate into lymphocytes as B or T. And the differentiation happens a lot in the thymus. I think I said it wrong back there. I think lymphocytes are part of red blood cells, but they differentiate whenever there's an infection. B cells, lymphocytes, they're antibody mediated, originate from stem cells. They mature and move to lymphatic tissue, which is your thymus, and lead to production of antibodies. Whenever they see a bad guy, antibodies are released. T cells are again a type of lymphocytes, and they mature in the thymus gland and move to lymphatic tissue after mature. And here's an image of it. And the lymphocytes have antigen receptors, so that kind of makes them kind of specific, especially after they've had their memory, after you've been exposed to it once. And each receptor only binds with a specific antigen. When the antigen receptors combine with the antigen itself, is activated and adaptive immunity begins. Just know that there's an MHC molecule that's specific for certain antigens. They bind to the B or T cells and stimulate response. We don't talk a lot about it in healthcare, but know that it exists. You got cytokines, well, they're proteins secreted by a cell, regulates neighboring cells, and interleukin-1 released by macrophages. And interleukin-1 is also a drug, can be turned into a drug. It's not very much fun to give. A lot of things you have to do with it. And here's how they proliferate. And again, it talks about the lymphocyte proliferation. Just kind of be familiar with it. It's not super important, except maybe with blood levels, they'll draw to see how the T cells are doing, especially with the AIDS and the B cells, but more the T cells that I've seen drawn, maybe because I worked with a lot of AIDS patients. And here's how they proliferate. And so you got a dual nature. Lymphocytes give rise to two types of immune responsive, antibody-mediated and cell-mediated. Antigens can trigger both types of responses, and both types are able to recognize the self versus non-self and use specificity and have memory. So this slide's important to know that lymphocytes got two jobs. You need to know where they come from and the different types, B and T. So that's not too hard to remember. Antibody-mediated immunity is effective against antigens in the body fluid like blood in the lymph. And they use B cells to produce antibodies. So they're effective against bacteria, viruses, and your toxins. So this is not quite the same as the COVID vaccine, which used a whole different way of doing it to get this response. They used RNA messenger to do the specific mediating to get the specific cell, so to attach to these antibodies. So it's a little bit different how they required the COVID-19 was kind of a new way to do a vaccine instead of using a live one or a passive one. So you don't really need to know about the structure, but they are a V or a Y. And this one's the Y. Then you have antigen binding sites, which are specific antigen binds. And they have a valence, just like electrolytes have valences, electric ions do, but they're not electrical. But they have 5 classes of immunoglobulins used to destroy antigens. So you really don't have to remember, but you'll hear about IgG, IgM, IgA, IgE, and IgD. You'll hear about it quite often, and you'll have to often, if you're a nurse, you'll have to give these drugs if you work oncology and arthritis and autoimmune diseases. And their drugs helps build up the immune system. And you can see what they kind of look like, Y's and V's. Ig is I guess the one that you hear more about. You see it can cross the placenta and helps protect the fetus from infections. But it also has the bad part about it is that it is responsible for Rh reactions. So as mama is Rh positive and baby is Rh negative, you can get away with the first time, but the second time, if you don't protect with RhoGAM injection, you'll get a hemolytic disease, which is the breakdown of the red blood cells, and the baby ends up without any red blood cells. Kind of a bummer there. So they give RhoGAM if the first baby, they give it with the first baby, and then with the second baby, with second pregnancy, they'll give it probably about in the early third trimester, and then they'll get it again after they've tested the baby to see if it's Rh negative and Rh positive. Make sure they don't get this disease. It's one of the ways babies died years and years and years ago, but RhoGAM's been in place for years. IgM is in blood transfusions. What they do the ABO. When you look at a blood bag, it'll say that they are tested by the ABO blood system. And so they test it to make sure that the RHs match and there's no antibodies, specifically the IgM. So that's kind of important to know what you're looking at when you see that on your blood bag. IgA, you find in your saliva tears, found in colostrum and milk to produce immune protection for the newborn. And that's why they are big into protecting moms with the colostrum and breastfeeding. That's why it's a big, huge push for breastfeeding. But not all mamas can, so sometimes this push makes the mamas feel bad when they can't breastfeed, especially when they know it's the best thing for their baby. IgE binds to the mast cells, basals, and stimulates inflammatory response. So we have drugs, antihistamines, prednisone does against this one. IgD functions as an antigen binding receptor on B cells. Effects on antibodies is inactivates antigens. That's the big whoop. That's what they do. That's what antibodies are, big function. And they do that by binding antigen together. They activate a complement system, which is a healing. They release inflammatory chemicals, start fighting the bad bugs, and this all ends up with phagocytosis. Sometimes the phagocytosis gets a little bit too much overwhelming, and you have to stop that process. If they cannot do it, usually there is a regulator that does it. You have your primary response is exposure to the B cell. B cell undergoes division, forms plasma cell and memory cells. The big thing with the plasma cells is that you're exposed 3 to 4 days, but in between you start developing disease symptoms. That's why they do with COVID, they started out a 3-week quarantine, then it went to a 2-week quarantine, then a 10-day quarantine, and it's down to a 5-day because of this cycle. So you got memory cells. So it remembers what antigens it's been exposed to, and that's why you have an immune system, because it releases all these antibodies. And here it is again. And I think this bottom one is the one you need to remember, this bottom little slide part. Got cell-mediated immunity, and is used against antigens in the cells and the tissues. And it's effective inside the cells, viruses, bacteria, fungi, and protozoa. And it's big with the T cells. So that's why they calculate with with AIDS, the T cells. And most people in this country do not have fungi or protozoa because we You have meat inspectors that make sure the meats are safe to eat. And I remember one year the relative